Welcome. Have you ever noticed a yellowish bump on the white part of your eye? It could be a pinguecula. In this video, we'll explore what this common eye condition is, why it happens, and what you can do about it. So, what causes a pinguecula to form? The exact cause isn't fully understood, but it's strongly linked to prolonged exposure to ultraviolet, or UV radiation from the sun. Think of it as a sunburn for your eye. Other contributing factors include chronic dryness, irritation from wind or dust, and simply getting older. These elements can all irritate the conjunctiva, the clear membrane covering the white of your eye, leading to pinguecula development. Now, let's dive into the pathophysiology. At a microscopic level, a pinguecula is a degenerative process in the conjunctiva. The collagen fibers, which give the conjunctiva its structure, break down and become disorganized. This degeneration is accompanied by an accumulation of elastin, another protein fiber, and deposition of fat and calcium. All of this leads to the characteristic raised, yellowish appearance. Pinguecula is a very common condition, especially in adults. Its prevalence increases with age, and people who spend a lot of time outdoors, particularly in sunny or windy environments, are at a higher risk. It's generally more prevalent in populations closer to the equator where sun exposure is more intense. How do you know if you have a pinguecula? Well, often, it's noticeable as a small, raised yellowish or wettish bump, typically located on the side of the eye closest to the nose. While some people experience no symptoms at all, others might feel dryness, gritness, burning, or the sensation of having something in their eye. In some cases, the area around the pinguecula can become inflamed and red, especially after exposure to sun or wind. Diagnosing a pinguecula is usually straightforward. An eye doctor can typically identify it during a routine eye exam simply by looking at your eye. They might use a slit lamp, a special microscope with a bright light, to get a closer view of the conjunctiva and assess the pinguecula's size and characteristics. No other specific tests are usually needed. While pingueculae don't have distinct types, their severity can vary based on size, degree of elevation, and the presence of inflammation. Some pinguecula remain small and stable, while others can gradually grow over time or become more inflamed. The management approach will depend on the individual pinguecula's specific characteristics and the symptoms it causes. Fortunately, pinguecula usually don't require treatment unless they're causing bothersome symptoms. For mild dryness or irritation, artificial tears can provide relief. If inflammation is present, your doctor might prescribe steroid eye drops to reduce redness and swelling. In rare cases, if a pinguecula is very large, significantly impacting vision, or causing chronic discomfort, surgical removal might be considered. However, this is usually a last resort, as there's a risk of recurrence. The best way to prevent pinguecula is to protect your eyes from UV radiation. Wear sunglasses that block 100% of UVA and UVB rays whenever you're outdoors, even on cloudy days. If you work outdoors or spend a lot of time in windy or dusty environments, consider wearing wraparound glasses or goggles for added protection. Also, using artificial tears regularly can help keep your eyes moisturized and reduce irritation. The prognosis for pinguecula is generally excellent. It's a benign condition that rarely causes serious problems. While it may not completely disappear, it can often be managed effectively with conservative treatments like artificial tears and sun protection. While some research is ongoing to better understand the underlying causes and potential treatments, the focus remains on alleviating symptoms and preventing progression. Talk to your eye doctor if you have concerns about a pinguecula, and they can provide personalized advice and management strategies.